rang me up and said, so then he said, you've got?
Yes.
It was because they'd said, so then we went to the local shops.
Yeah.
I had an area of skin that felt like a different texture to the other side. Something didn't look quite right. I didn't think anything of it at first, but then I started noticing some painful twinges in that side as well. And it was after I felt the pains that I thought, actually, I should probably get this checked out. While my friend was there for the first couple of days,
Okay.
I did that
Yeah.
on my own.
Yeah.
Just on a Sunday morning, had a
Yeah,
wander around the
that's
art
nice.
gallery. A whole sort of kitchen area, so
Yeah.
washing machine as
Lovely.
well, dishwasher,
Yeah.
oven, microwave.
Yeah.
Basically home from home.
Good.
When they told me, obviously I cared, but it, you know, they gave me leaflets to take home, and it was just the one that said about, you know, how to tell your children. And when I thought about that, that was like, I lost my hair, I had sort of issues with skin, digestive issues, aches and pains, quite a big list. It was tough going. I had a previous heart issue, a leaky heart valve, and because of that they said that with regular radiotherapy there may be sort of further issues of excess radiation to the heart could sort of make my heart condition worse.
Just going to get a little bit tighter as we clip it in.
If you wanted to treat a cancer that was near the spinal cord, then we would be able to cover that and then avoid the spinal cord. And proton beam therapy is used as standard of care in the UK for kind of those hard to treat tumours, but it's also used for children and young adults.
What was the journey like here today? Because it's from Ely, isn't it?
Like a setup of the queue
Yeah.
in the shopping centre.
Oh, brilliant.
They're patients that we usually treat both the chest, the breast wall and the nose, particularly the lymph nodes behind the breastbone. And they can be very close to the heart.
Sometimes when you sit and you're planning their treatment, you're trying to work out how you're going to get around those problems, and because proton beam radiotherapy is delivered in a different way, you might be able to circumvent those problems. A lifetime risk to a patient from radiotherapy for heart problems is about 1% for the average patient. If that lifetime risk starts to creep to up to 2% or more, those are the patients that are eligible this study. So we're trying to see whether we can reduce their heart dose back to acceptable levels. And they tend to be patients who are more at risk, so patients who have underlying cardiac conditions, or patients where anatomically they've just got normal variant anatomy. Anatomically their breastbone might sit much more closer to the heart than the average patient.
Okay for now.
Seems like a natural rate with the machine, and then sort of the treatment parameters, and then at the bottom.
I'm feeling optimistic about my treatment. I'm pleased with how everything is going so far, and I know I've still got more treatment to come, but I'm just choosing to take one day at a time and see how it goes.